Lasers are all the rage these days. They can permanently remove hair, improve your complexion, get rid of ugly veins and tattoos.
But there are a few things that you should know first. So Dr. Deborah Manjoney is here from the Wisconsin Vein Center and MediSpa with a few questions that you should ask before you get procedures done. Welcome back to the show.
Thank you very much.
So nice to have you. I think that's a big question everyone has is if they want to go do some cosmetic procedures or some MediSpa procedures, they want to know that they're going to the right place, to the right person. What's the first thing you should look for?
Well, one of the first things you should look for certainly is whether or not there is a physician on site or associated with the medical spa and the physician is readily available. It's very important because you want to know that there is somebody with that kind of training who's overseeing what the training everyone else has had. You know, lasers, for instance, if somebody's going to have a laser procedure, lasers are considered Class 2 medical devices, so it has to be purchased by a physician. However, in the used market, people can just buy the lasers.
Oh, okay.
And
really?
Yes. And so, you know, people can have lasers without necessarily having a physician's oversight.
Now,
so you do want to be careful.
Speaking of physicians, I'm glad you brought that up because I think it's worth mentioning that when you pay attention to the title and somebody is doctor something, doctor doesn't necessarily mean physician.
Right, and it's no disparaging remarks at all about somebody using the term doctor if they have gotten training to be a doctor of something, but it doesn't necessarily mean they're a doctor of medicine.
Right.
And so if you want to check on that, you should. You know, there are some people around who are doctors, but they're not medical doctors. That's the impression that they're portraying.
So should you look for the MD after the name? Does that matter?
DO, you know, I think you need to just ask and ask what the training of the person is.
Okay, that's important. How about for injectables? That's a hot thing right now. A lot of people are doing that. Who should be performing them?
Again, it should be a physician or it should be a nurse or a physician assistant who's been trained in these techniques. Now, in Wisconsin, there's really no law that says you have to be a trained physician or you have to be a nurse to inject if there's a physician there overseeing things. However, I think it's good practice to be either the doctor or a nurse or advanced nurse practice person or physician assistant in order to perform those types of techniques.
Who shouldn't perform them?
Well, there are some places where they have somebody who's an esthetician performing them, and in this state, an esthetician is really a cosmetologist, so they may only have had some training in hair cutting and things, and may really not have had any training and medical knowledge of the anatomy of the face. And I think that's a big concern.
Absolutely.
And so even though they may be in a physician's office, that may not be the person you want to have doing the injections.
Makes sense.
I think this is a great thing for us to be discussing today, questions people should ask, because these types of procedures and treatments are getting so much attention. It's becoming more accessible and available to people. More people are doing it, but it doesn't mean that it's something you should just enter into without you know, doing some research.
Thinking about it and researching it, but also when you go in and go to the place, make sure you have a personalized consultation. Don't just go in and think you're going to go in and get Botox or injection. Go in and be able to sit down and talk to someone who can talk to you about your needs, maybe even steer you away from it if they don't think that's the appropriate thing, because you want somebody to be able to offer options.
How do you know if some place has the best technology? Because obviously we're not trained in the medical industry. We don't know what's hot, what's good, what procedures are good, what machines are good. How can you find out about technology?
That's a very difficult question. You can ask what type of technology is being used, and you can go to any of those companies' websites and look up the machinery to know if it's state-of-the-art or not. The other thing you can do is ask specifically, how does it compare to something else? You know, for instance, hair removal, very, very common in many, many places. Are they using laser? Are they using intense pulse light? Both of them work extremely well. And so there's nothing wrong with having either of those treatments. But you might ask them, you know, how many treatments do you expect this to take? What type of laser is it? Is it painful? Because there have been advances either with a cooling tip or with the type of wavelength and the number of laser shots per second, for instance. The faster the laser shots, the less discomfort because you're delivering the same amount of energy, but it's broken up into multiple little shots instead of one big flash. So there are lots of questions to ask.
As a physician, your training is in cardiology.
I'm a cardiovascular surgeon, so it's not necessarily intuitive that I would be, you know, the physician at a medical spa, but it's a vein center and medical spa. I have a lot of training in vascular surgery, And this was just something that I felt as a woman would be a great thing to do.
I think so too, and I think that's one of the things that makes people very comfortable visiting your spa in particular is your training and background. And I'm sure that you care a lot about proper training and equipment and the science behind it all. But you also care, because I've been there, about the staff in the front, that they're friendly and that people feel welcome when they visit. You see that as being important too.
I think it's very important to treat our patients as VIPs. We certainly try to. We certainly try to make them feel welcome, try to make them feel at ease. It's not always an easy decision to go somewhere and have something done that may alter your face, or do something on your body that you're feeling a little uncomfortable about, or you might have some concerns about, should I be doing this at all? So I think people need to be made to feel welcome, and try to put them at ease as soon as possible.
Absolutely. You also say that people should have a consultation. That's very important. And you're offering right now a complimentary consultation.
All of our cosmetic consultations have always been complimentary and will remain so.
That's great.
And I think it's important too to understand if you're having something that's medically necessary, like some of the vein procedures that you do where there's really a medical problem, and to understand your insurance as it relates to those procedures.
Yes, and that's something I think is very important. We really go out of our way to make sure people understand what their insurance will pay for. Matter of fact, we have links on our website even that people can go to and look at a lot of insurance terms. We have a glossary of insurance terms, because I know, even as a consumer, it's very difficult sometimes to understand what your insurance company is telling you.
Definitely, and there's that website that you just mentioned. It's wimedispa.com. You're located in Pewaukee on Georgetown Drive. Again, it's Wisconsin Vein Center and MediSpa. The phone number is there too for more information, 262-746-9088. And right now people can come in, receive a free skincare evaluation, discuss concerns, and for people who mention the morning right now, you also give them 10% off their first treatment.
That's right.
That's a great offer.
Right.
Thanks for
you,
being
Doctor.
here. That was really
Thank you
great.
very much.
Yeah. Later in this show, call it